We are the SSRIs. Today we are going to do what we do best. Block, block, block.
Block serotonin reuptake.
And keep it moving in the synapses.
It's a team effort.
Let's work with nurses, providers, and families.
And get these patients back to their happy, healthy baseline.
Go team!
Our team is the Selective Serotonin Reuptake Inhibitors. Our starting lineup is citalopram, escitalopram, fluoxetine, paroxetine, and sertraline. We're all on defense today. The play is to head into the synapse and block those neurons from taking back our serotonin. We want it flowing freely in the synapse to alleviate our patient's symptoms and improve their mood. As antidepressants, we are used to treat mental health conditions like depression, anxiety, panic disorder, phobias, obsessive-compulsive disorder, and bulimia nervosa. Some of the symptoms we can help to manage are trouble concentrating, feelings of worthlessness, irritability, and low moods.
SSRIs are usually taken in tablet form. Depending on the type of SSRIs prescribed and the severity of your depression, you usually have to take 1 to 3 tablets per day. When prescribed, you would start on the lowest possible dose. It will usually take 2 to 4 weeks before you begin to notice the effect of SSRIs. Course of SSRIs therapy should be at least 6 months to prevent reoccurrence of symptoms.
Tell your provider about any side effects, especially when you begin taking this medication. The good news is that the side effects of SSRIs are generally more manageable than those of other antidepressants. There are 3 types. Mild or short-term side effects might go away as you get used to the drug, or your provider can help you manage them. Examples: nausea, diarrhea, occasional headache, or insomnia. Other side effects are less manageable, like sexual dysfunction, or even counterproductive: anxiety, agitation, panic, the opposite of what we want. It's rare, but some side effects are life-threatening. You or your family should call your provider immediately if you notice thoughts of suicide or dramatic medical symptoms such as seizures, confusion, fever, or tremors.
It is important for our patient to remember it may take 4 to 6 weeks until they are feeling the effects of their medication. Our patient must comply with their medication regimen, take their medication in the morning and with food, avoid alcohol or other CNS drugs, monitor for serotonin syndrome, and report any thoughts of suicide or harm to others. Do not take SSRIs with other medications that increase serotonin levels, including MAOIs and other antidepressants. Do not use if undergoing thyroidazine therapy, and if pregnant, avoid the use of paroxetine. Patients with severe renal or hepatic impairment should use SSRIs cautiously, and always remember there is a high risk for suicide in both adults and children.
So when a patient is taking this medication, we want to monitor the weight gain and encourage the patient to regularly exercise and eat healthy. We also want to monitor mood improvement and access for suicide. Make sure you also monitor your sodium intake for hyponatremia. So how do we know our medication is working? Increased sense of well-being, increase in surroundings, decreased obsessive-compulsive, decreased frequency for panic attack, decreased mood alteration.